We currently have about 50 people online, but that usually jumps up to about 100 over the next 10-15 minutes. When the webinar ends, you will receive a short survey. If you could please just take the time to fill that out, and if you would like us to mail you a certificate, please check off yes and type in your mailing address in the survey, and then we will send you a certificate of participation. So today we are here for the We Can Work campaign. We have two guests with us from NIAPers. First gentleman is Oscar Jimenez, who I got to meet during this process. He's a great guy. I really enjoy him, and I saw him present about 6 months ago or so, and that was great. And then the other gentleman that we have today is Matt Mathai. He's a gentleman who, really, when I first met him, he really helped me open up my eyes to the different possibilities that were available. And I think that through this campaign and through a lot of other campaigns, I'm sure he'll do the same for a lot of other people too, or has done the same for a lot of other people too. So it's great working with these two guys, and take it away.
Thank you, Tony.
Thank you, Tony.
Shall I, Oscar? Okay, so first of all, thank you very much for having us. I'm really grateful for all of you who are taking the time to be on this webinar with us. We are very grateful to the Office of Mental Health in particular for their support in the We Can Work campaign. This campaign, just to give you a little context, was one of the things that in our advocacy, there was a broader statewide advocacy around employment called the Partnership for Employment and a Campaign for Employment that many of the state associations, including NIAPers, came together. A few years ago, we met with the governor's office, we met with Office of Mental Health, and really spoke with people about wanting to make employment a higher priority, or if nothing else, one of the lead priorities of the state government, especially as the government and the new administration at the time was talking about having more interagency activity. And what would that look like? And one of the biggest barriers that we'll start to talk about today, and that people have been talking about for years, is the interagency silo, or the lack of coordination between government agencies, and how that could be resolved in order to increase employment outcomes. So that's something. So one of the things we called for was an interagency work group on employment. That's happened. Now through the Most Integrated Settings Coordinating Council, we have an interagency work group on employment, along with a housing work group and a transportation work group. That's just one example. Another thing we asked for is for the state to pursue the Medicaid infrastructure grant. The state did that, and actually has applied, and Office of Mental Health on behalf of the state applied for a Medicaid infrastructure grant for a comprehensive employment services system, with the whole intent of removing barriers, bureaucratic barriers to employment for people with disabilities overall. And the Office of Mental Health led that effort to do that. And we're grateful for that. And the third thing that I want to point out, among others that I'll go on a little bit later about, is this We Can Work campaign, because we all recognized, including the Commissioner, Michael Hogan, recognized that there needed to be a focus on a grassroots movement. Is there a demand for employment by people with psychiatric disabilities, and has that been really promoted and addressed? So we took that on. We both, without the We Can Work campaign, even as a community in NIAPers, wanted to take that on as a charge and as a challenge to really talk to each other about work and what does that mean. John Allen himself said to me many years ago, we needed to help each other kick the tires of employment, if you will. If we're really going to support each other to make it happen, we needed to hear from each other, those of us who have made that effort, and to go back to work and have the messaging come from people with psychiatric disabilities themselves. So thus the We Can Work campaign was born. Federal funding was pursued. Beslon Center for Mental Health Law and the Office of Mental Health pursued this money and was able to provide some funding towards the development of the campaign. And Oscar Jimenez, as the current chair of the Employment We Can Work campaign, was able to get us going in many respects. There are probably 4 messages that we've emphasized all the way through in the We Can Work campaign. We want to really be able to challenge a few things. One was this notion that people would be harmed by work, that employment would be harmful. In fact, what we wanted to express was that unemployment was what was harmful, and you'll hear more about that today. And in contrast, that employment can be helpful, and was helpful to many of us, and will be helpful to those people who pursue it, and how that's happened is the second message that we wanted to make sure that the campaign prioritized. A third message is about benefits and the really the amazing number of work incentives that exist. Although we're not going to be able to get into all of them in detail today, we are going to refer to them. Ultimately, the final message and really the overarching message of the whole campaign is that we have hope, we can work, and that we can challenge and change the narrative that we might have told ourselves at any given time over the course of our process of experiencing a disabling condition or a tragic circumstance in our life that said we can't work anymore. So now we can actually say to ourselves, no, you know what, maybe we can, maybe that's a possibility, maybe with these new services or these new options, and most importantly, because I heard that person could do it and did try it, because they took the risk, I will too, is what this campaign has become about. And so towards that end, let me ask Oscar to weigh in here, and let me introduce Oscar. He's our our program evaluation and specialist in NIAPRS, and is also working in our collective as a Central New York educator, and is also working within the partnerships with industry in the Real Jobs Project in partnership with the Workforce Development and Bergenblatt Institute. Oscar.
Thank you, Matt. Good afternoon, everyone. Again, my name is Oscar Jimenez. I'm really grateful to be part of this campaign, and I'm so glad to hear that so many of you were interested in not only learning about this campaign, but also in getting more information so that either you directly or the people that you support or that you work with or that you advocate for can actually achieve employment, and not only a job, but also a career, and not only a career, but also be part of the society, and both by participating like everybody else does through work, and also be part of the economy, especially in these times in which the role of everyone is needed. Certainly people with psychiatric disabilities are also saying, we want to work, we can work, give us a chance. And we're really excited about the timing of this campaign, not only for us as a community of people with psychiatric disabilities, but also for our state and our nation. And definitely we want to be part of that, and hopefully this campaign will contribute to that end, and to really both inspire people who at this moment may be sitting at home wondering if it will ever happen for them, and also concretely passing along information about resources that are available to every one of us, so that we can actually pursue our dreams of whatever that is for each one of us. And you know, before I really get into the some of the content, I was really there's one particular story that I've been really moved since I started helping with this campaign, and it is a story of I mean, there are many stories that I've been moved by, but there's one particularly that I wanted to start by this forum, this seminar, by sharing it with you. It's a story of a woman who about 15 years ago was actually living in her car, and she had gone through several crises, went through 13 hospitalizations, and at some point, something within her told her that she should go back to work, and she wanted to do that, but she didn't know how, because she had been disenfranchised for so long that really didn't know where to start. So she walked into a state office that she thought would help her, and they told her that she was unemployable, and she walked out and went back to her home, and actually that she was unemployable, and that they would not invest in her further education or supporting her to find a job, and that she would not benefit from receiving those services. So she went back home, and she discouraged. She tells us that she watched TV for a few more years because she just really agreed to that notion that she wasn't able to work and that she was unemployable. And for a few years, she lived in that lie that it was not going to happen for her, that she just should be happy with getting that SSI check. Somehow, other people were put in her life that really challenged that. And through a series of things that, and a lot of information that we're going to share with you, her life changed. One day, she saw other people like that have faced crises like hers be up and about working. And she said, you know what, maybe that can happen for me too. And slowly, she started volunteering, started believing again that she could work and that she had a purpose in this world, that that her life was not, her work life and professional life was not over. Through the years, she just continued pushing forward, and today she's actually the director of one of the most important peer-run agencies in the state. And she not only is being able to contribute a lot through her work to the lives of many people, but she's at a more personal level an inspiration to all of us. So we just know that stories like her, there are hundreds of, and if not thousands, that we could actually bring to you. And really, if anything, we really want through this campaign to make sure that these stories are known. And we'll share with you a little later some of the specific tools, but the most recent that we'll like make sure that you know about and that you have the chance to actually view is a DVD in which this story that I just shared and the stories of 9 other men and women who are also a source of inspiration are portrayed there. And we really hope that that you can actually also have a role in passing along this inspiration and you know, the hope that many of us do have, and that take actually an active role. That it's really ultimately the responsibility of everyone, and even if you're not you know, able to necessarily dedicate your full-time work to employment, each of us can have a role in making sure that those around us actually get that inspiration, hope, and information. So with that, hopefully that will give you a sense of what we're actually going to be doing today. We're going to be sharing with you some of those stories and some of the information that really we believe can make a difference in people's lives, especially in making sure that every person with a psychiatric diagnosis and disability in the state can be a success story, just like the story of the person that I just shared with you. So what we usually start with is by making sure that it's clear to all of us that unfortunately we you know, people with disabilities and people with psychiatric disabilities more specifically really have gotten the short end of the stick when it comes to employment and also when it comes to being integrated economically. And the slide that you're seeing at this moment basically shows that only 1 out of 3 people with disabilities in New York State actually has employment. And this is actually considering all kinds of disabilities, physical, intellectual, and psychiatric. But when we actually look more specifically at the level of employment of people with psychiatric disabilities, what we see, for example, is at the nationally, only 1 out of 5 people, adults in the mental health system, actually has some form of employment. More specific in New York State, and you know, we have different estimates, but the most conservative is that estimates are that really no more than 15% of adults in the mental health system actually have some form of employment. And unfortunately, many of those people that do work have actually employment that is only part-time and that it's actually not a major source of income. So what happens when we don't work? That means that we're relying on Social Security benefits or some other form of public benefits that to really survive economically. And for most of us, what that means is that a large number of us lives either in poverty or just one check away from poverty. And the most conservative estimates show that more than one out of three people with disabilities in New York State actually lives below the poverty line, and many actually close to poverty. And some of the information that we know, for example, is that more than 50% of people with disabilities in New York State makes less than $24,000, which in most parts of the state that makes it very hard for anyone to actually support a livable income, and also especially if people have families, especially in areas where housing is really unaffordable, like large urban centers, and most importantly, not be able to save or to build assets to really be part of the mainstream economy, and to also have ways of endure difficult times, like many other people actually are able to. So if that is a scenario, that the large majority of people with psychiatric disabilities do not work and are facing most likely some form of poverty, what does that mean to mental health recovery? What we want to share here with you is that, as Matthew was saying at the beginning, that all the research actually shows, and we are only doing a few bullets here, but certainly there's a lot more knowledge out there. All that information points in the direction that unemployment in and of itself is harmful to mental health, and that unemployment, again, in and of itself, has the power to cause psychiatric disability, and at minimum become a barrier to mental health recovery. And it's really definitely a no-brainer for those of us who have been unemployed and being able to not able to have enough money to live. But some of the more concurrent information available shows, for example, that just even through financial stress, being unemployed or not having enough money to live is a major risk factor for depression. And not having unemployment, even having the income but not having a job, is also has also shown to just create a major a major setback in self-esteem and self-confidence. For example, what some studies have shown is that even when workers that become unemployed continue to receive the same income, still their level of self-esteem decreases, the level of depression increases. Another major area that is so important for mental health recovery is our social connections and the social capital that we actually have available to us, the relationships that we're part of. And being unemployed means that there's a whole there's a whole world that is really denied to us because everyone else who works not only has friends through their neighborhoods or their communities, but also relationships through their work. And when that is non-existent, if someone becomes unemployed or someone has just simply been unemployed for several years, there's a whole set of relationships and connections that are helpful not only emotionally and for mental health, but just simply uh, that that are just part of being human, that are simply non-existent. So not only unemployment is clearly a barrier to mental health recovery, and possibly even uh, be a contributor or cause a lot of the mental health uh, diagnosis that people face. But even at the more physical level, unemployment is clearly associated with also bad health. And this is a fact that a lot of people unfortunately don't know about. But people with psychiatric disabilities have on average, a 25-year lower life expectancy, which means really that on average, a person with psychiatric disability dies 25 years younger than someone who does not have a disability. And some of the main reasons behind that are related to poverty, are related to some risk factors like smoking, um, um, lesser access to quality healthcare and prevention, and all those factors are definitely associated with being poor and with being unemployed. So not only we're seeing that unemployment is harmful to our mental health, but also even just at the more basic level, our physical health. So if unemployment is so harmful, is it possible then that employment, the other side of the coin, actually is helpful? And Matthew here wanted to share with us some of what we know of the way that actually obtaining a job and being part of the mainstream economy actually has a positive impact in our lives.
Well, the first thing, thank you, Oscar, that I think of when I think of how employment has benefited people, I think of my own experience. And I think for many of us who are on this webinar, we can turn to our own experience in finding meaningful activity or meaningful opportunities to contribute to our communities, either through volunteering and then eventually through paid work. We found that our recovery has been promoted on a number of levels. We've felt, for example, and if you don't mind, we'll click over here to the next slide. There's some real benefits that have come out of, and one of the biggest ones that started to happen for me immediately was that I started to become less isolated. I started to, the social capital that Oscar talked about earlier developed as a result of being involved in, for example, I volunteered most immediately in some settings around things that were important to me at the time. For example, like soccer, for example, is something I really enjoyed doing, so I got involved in places where soccer was happening. I loved animals, so I volunteered at the local animal control and just started cleaning out cages and spending time with the animals, the dogs in particular, and I developed a skill set actually as a result of that, and really found a way to provide something that I had to offer. And that ability to discover something that I had to offer at a time when I felt like I was a drain on everybody else, that society did not need me anymore, that I oftentimes pretty much built evidence and felt the evidence of why it was no longer necessary. And that gets to change here. And I can't emphasize enough how powerful that is for, and has been for me, and really for everybody else that gets to experience that. So then it becomes no question, if I develop those areas and have that kind of sense about myself, then yeah, my optimism about the future, my likelihood that I'm going to experience the same kind of symptoms that I experienced before is far less, and that the potential for any future crises or difficulties that I go through to disable me are far fewer as well. I actually have transcended or been able to overcome some of the more challenging things that have happened in my life since that time, probably because of my ability to work and my ability to feel that capacity in my life. So that's huge for me, and that I can turn to a few things. The fact that I have some skills that I can offer, that I've learned, a place in which I can learn new skills and find new supports, that I feel like I have a contribution, that I feel like I have a sense of independence, which is, we're something that we haven't necessarily experienced, especially as we get involved in the system. People starting to feel like, that they needed to watch me and take care of me and be responsible for me. That I started to be able to take some responsibility for myself and develop a sense of personal decision-making power, a sense of autonomy, and ultimately an ability to take care of myself and do some things for myself that I hadn't been doing before. Getting my own place to live, or being able to pay my rent, paying for bills. These were all new things that I hadn't learned, and actually made some mistakes around. I mean, I got my first credit card notice in the mail, or invitation, I should call it, actually, in the mail, and spent it a little faster than my income could handle, and had to learn about some of that. And so some of this also brings up the need for other programs like financial literacy and self-sufficiency programming that we want to continue to talk to you about, which we'll probably do in another webinar, right, Tony? We'll figure out how to do our We Can Save campaign on that focus. But the idea that our quality of life actually improves with this one area, isn't a mystery to, and I have to, we can't talk about employment without talking about the state of our nation right now, and having more and more people relate to what it's like, people without disabilities, being able to relate to what it's like to lose employment, and to lose the opportunity to be able to feel like not only do we support our own selves and our family, but also have a way to contribute to society. So, let me stop there and turn back to Oscar to talk about some of our the testimonies that we do have. And I know there's going to be, I think the questions are already pouring in, so we're going to want to make sure we have some time for that and responding to all of those. So thank you for those of you who are already submitting questions for us. I'm looking forward to speaking to those as well.
Yeah, sure. Thank you, Matthew. And I believe what we can actually do is we'll share these some of these testimonies with you, and maybe that might be a good time to actually have the questions maybe answered. All right, great. So we'll do that. And so we started off talking a little bit about some of the stories that we actually have been sharing with us. And I just wanted to say that when we made an announcement of the campaign, we made actually a call for stories last fall, and we were really, really grateful to see that dozens of people responded and sent their personal, their lives really with us, and shared their lives with us, and did the work of putting them in writing, and just with the hope that maybe those stories could actually be conveyed to other people, and also give them the hope that they actually had at some point. So out of those people, in a very difficult process, the committee, the advisory, the We Can Work Advisory Committee, which is a grassroots committee, we're really fortunate to have representation of all parts of the state, and again, over 20 great leaders across the state that just volunteer all the time to actually have volunteered to put all this campaign together and to really make it happen at the local level. So this committee actually had the very difficult task of selecting a few of those stories to and invite a group of those people to be part of this DVD. And here are some of the human experience of the way that employment and really working has actually touched the lives of the people that that were selected to be on this DVD. And the first one is the story of this outstanding lady that shared with us that the dramatic change that really working has had in her life, and going from being literally homeless and really feeling that that her life had no meaning, feeling totally isolated, to feeling like now through work she has actually meaning, at the more the most human level, meaning in doing something that is really helping other people, but also at the most basic level too, that is so important for our quality of life. That she actually owns a home. She's been able to buy a car and get insurance for a car, and really support a quality of life that all of us actually deserve. Another gentleman that we've been very inspired by from Plattsburgh also shared with us the major transformation that that he actually had through work. And one of them, actually, one of the most concrete benefits is that the agency that he works right now for actually was really key in helping him actually go back to work, and I'm sorry, go back to school and get a certification as an office assistant that is something that he wanted to do for a long time. And he works now as an administrative assistant, for this particular agency. But one of the things that you see in that testimony is that the way that that his work is impacting him really is just seeing how the work that he does really helps other people also change their lives. And by seeing other people also accomplish things and say, hey, I am also going to graduate, and the satisfaction that he feels by seeing how directly or indirectly his work is actually contributing to change other people's lives. Another testimony is from a lady in New York City who also shared with us that she had not worked for 15 years. This lady is in her early 50s, which means that really she was out of work for a great part of her adult life, most of her 30s and 40s. And 2 years ago, she was given a chance to do a per diem work at an agency in New York City, and slowly she's now a steady part-time worker there. And for someone who had not worked in 15 years, really being able to do the work that she's doing right now is changed her life dramatically. She works as a receptionist for a residential program, and we can see in the testimony that really just having this part-time job is giving her every day that she works a reason to get up, and also just the overall quality of life, and sharing with us that she not only has a home and health, but most importantly, hope. And finally, another gentleman from New York City who is also inspired us so much, because this is a gentleman who had a career as an administrative person in Wall Street and worked there for many years. And this gentleman had since young a few episodes of depression that by which he had to be hospitalized, typically for relatively short periods of time, and he would be out of work for maybe a week, maybe 2 weeks, in several years, and his employer was always supportive, and he would, after his hospitalization, go back to work and do really well. So his employer was actually very supportive through the years. But the time came when he had a very significant episode of depression, and it was months that turned out to be 2 years of facing a major depression that it seemed that he felt that he would not get out of. And this time, when he tried to go back to work after those 2 years, after he started getting better, this time his employer did not want to take him back. And he actually, not only that, but in general, in his whole field of work, no one wanted to give him another chance. And this is the moment where he really lost hope, when he felt, now I'm ready to go back to work, and now it seems like no one wants to give me any job. So here's a gentleman who's really really doing everything, knocking on doors, handing out resumes, doing everything he could, and he shared with us that really his whole work and an idea of what he would do actually changed dramatically. And part of that being is that that today he actually has a personal experience with not only having a diagnosis, but what he also has an experience of is having gone through hospitalizations, having gone through being part of different programs, and that because of the role in which he is actually today in his job, he can actually look at someone straight in the eye and tell them, I know exactly what you're going through, because I did too. And that is given to him every day, meaning that he certainly didn't have before. And so hopefully this will give you has given you a little bit of the human experience of what Matthew and I were sharing before about the way that employment is harmful, unemployment is harmful, and the way that employment is actually helpful to our not only recovery but just overall quality of life. And again, like we shared at the beginning, these stories are some of the stories that are portrayed in the DVD that we have recently completed, and that at the end we'll actually share more information about how you can actually request a copy of, and we've been very fortunate to receive the support of Tony, Trahan, John Allen, and the Office of Mental Health to make sure that to make that possible. So I think with that, is this a good time for questions? Okay, all right. So we'll take a bit of a break in terms of the presentation, and we'll actually start addressing some of the questions that have been coming through. So I believe that Tony is going to let us know what the questions are, and then Matthew and I will do our best to answer them.
By the way, about the DVD, it's great. It's really, really powerful.
Thank you, Tom.
Okay, first question. Is this campaign going to include high-level employment positions, and also that consumers can have access to become members of boards of directors for agencies and not just peer-focused programs, but also provider programs?
That's a great question, and I want to say, first of all, that absolutely all kinds of positions and jobs are what we're hearing people want, not just access into an entry into the workforce, but as Oscar opened up with, but with careers, and career-minded. Also includes the need for education and skill training and all kinds of opportunities. So for example, one of the projects that Oscar is working on, and we'll actually be presenting on at the next Niagara's Employment Committee on June 19th, is the Workforce Development and Burton Blatt Institute's partnering project with Niagara's, which is called Real Jobs Partnership for Employment. And that project actually works directly, connects, basically bridges the gap between employers and industry with mental health providers and employment providers. So it's specifically targeted towards that end. And so that's one example of how we want to make sure employers are aware of the capacity of people with disabilities, and specifically people with psychiatric disabilities. And other areas, of course, in promoting education is working with the Department of Education and advocating for more interagency efforts to create secondary education opportunities. So that's the first kind of stab at that question. Oscar?
Yeah, I'm also thinking, great question too, and just to complement it with the story, one of the multiple stories that we also could tell you about people that just have also been able to take that path of not only a job but also a career and higher paying jobs. And definitely the campaign wants to make sure that when we talk about employment, we talk about all of that. And some of the stories that we've also been sharing about are the stories of men and women who are doing that a day at a time. And there's one particular story that comes to mind is the story of this woman from Rochester that you will see also on the DVD when you get the chance to see it, and who is really pushing really hard. Her husband and she have been able to get a comic book store started because they really loved comics and comic books, and they have a little business out in Rochester, and she's also going to work she probably has already started by now at a national company for the call center, and mainly because they have tuition reimbursement, and she wants to go back to school to get her master's in business because she wants to continue on a business career. And certainly we are making sure that we share with people the successes across all fields, because certainly for many of us, getting better and going back to work has been actually to contribute our personal experience in the mental health field, but certainly we can work in anything.
You know, and I wanted to comment on the board discussion, which is a great suggestion for the campaign to address. I think one of the areas, you know, that has been important to the campaign is to talk about how volunteering and time, you know, not necessarily just earning a wage, but also providing a contribution to community and through boards and other communities that actually are out there. That's one way that can be done, and we'd want to encourage that. The skill, you know, the question becomes, you know, what, you know, the part of the, I think the campaign advisory committee can think about as a result of that question is to, you know, where do we need to do some advocacy to increase that opportunity. So we'll, you know, keep that on the list as one of the things that we want to continue to promote and figure out more concretely how we do that. So, for example, I'm thinking about at these regional forums that we start to have, you know, making sure that that's one of the areas that are on the list that people could see as opportunities, and as agencies come forward to increase the involvement of people with psychiatric disabilities, that having experience in being placed on boards and being trained to be on boards, governing boards in particular, be part of that. Tony, you have another question?
Yeah. So what role does stigma and discrimination play in this picture? Did these successful individuals, who you so eloquently referred to, obtain these positions in spite of acknowledging their psychiatric disability, or because they were careful to minimize their labels as psychiatric survivors?
Another great question. I'm not going to be able to speak to each of the individuals on the DVD, for example, but you know, many of us have different stories about how that needs to be addressed, either personally. So, you know, we'll talk a little bit about rights around the Americans with Disabilities Act a little bit later. But we do, you know, there's no question that discrimination has played a role as a barrier. And actually, this is part of the presentation we're going to be doing a little bit later on the different barriers and what we need to do to address them. So, first of all, I want to validate the question, the point that discrimination is a context that we're dealing with here, especially for those of us with psychiatric disabilities. And disclosure has been a barrier. And it's something that, you know, no question has been one of the reasons why employers might have had a harder time choosing to hire somebody. And, you know, the cases are probably fewer than, you know, that actually show up in court, or, you know, that actually get challenged than the discrimination actually exists. We have seen examples where people are starting to feel like electronic application models and specific types of, you know, you might walk into a store and instead of being able to hand somebody an application or fill one out, you have to take a test at a machine, and some of these tests are personality tests that may either intentionally or inadvertently, you know, describe that or give the impression that someone has a form of disability. So some of those kinds of things we may need to take on.
Just wanted to I just wanted to say one more thing, and it's always hard to talk about the personal stories because first of all, we're conveying the stories that of what we know of the people that came forward, and we wish that they could actually be here to actually speak for themselves. But what I do want to say, and that we've been saying, is that while each one of us and each one of the people whose stories we've just commented on or whose stories are actually on the DVD are special and have a unique path and are really inspiring, I like to say, we're not that special, meaning there are some things that we can learn from their paths in terms of how they utilize their resources, what strategies they actually what resources they tapped into, what worked in their paths, but that can be available to anyone. So hopefully that also gives a sense of what we're really trying to convey here, that that employment is possible to anyone, and that we have so much to learn from each other, really, of the way that we actually manage disclosure, the resources, the people how we actually tapped into our personal networks to find a job, how we at times we just had to go against all odds, like the woman that walked into a vested office and was told that she was unemployed, but she kept pushing forward anyway. Years later, the determination that we that at times we need to just the only way that times that works is when we support one another and we actually learn from one another. So that's what was coming to mind. Sure.
Can you talk a little bit about stigma that people face when they go back to work, and including self-stigma?
Sure. I'll start with that, Oscar.
Sure. We certainly had. We're stopping at a point here because we saw that we had several questions already coming in. We do have a section coming up in a couple minutes in which we're really trying to address what are the actual barriers for employment. So I would actually say that we wait a couple minutes until we return to the presentation so we can give full justice to the topic, if you don't mind.
So what type of vocational agenda do you recommend for clients with mental illness?
So what kind of vocational, it sounds like the question might be about, and if we're wrong, please feel free to send in a clarification, but it's about what we can do to actually move ahead with our effort to get a job and to make a plan. So I think that is going to be something we talk about in this presentation as well, and I'll spend some time on that. Okay, Tony?
Are there going to be other alternatives for employment training for mental health people besides VESID?
Great question. In a nutshell, yes. So we can talk a little bit about those as well as we get into the barriers. So let's move into the presentation then, it sounds like. Are there any other?
Just one more clarification question.
Okay.
A person has a question about the DVD that we're referring to, and how can they view that?
Sure. I mean, I'll give you the nutshell right now, but we'll repeat it at the end. So this DVD, like I said, we've been able to produce that with the support of the Office of Mental Health. So it will be made available for free, without cost. The request that we actually have is that we're really hoping that this DVD will actually be utilized in all the multiple programs that that are around the state, and we're asking people that requested to think through a little bit. Where would you like to use it? Do you have a vocational group? Do you have an outpatient clinic where you can show it in 2 different sessions? Do are you part of a community organization that can show it at a church or at a peer support group, and that you just let us know. So we actually have a request form, which is very simple, basically with your contact information, where we need to ship it, and also asking you how you're planning to use it, because we really want to make sure that this DVD actually makes it to the people that ultimately are going to benefit from it. So that's the short version of it, and we'll give more information of. For now, I can say hopefully our contact information is at the end of the PowerPoint slide, and you can send me an email, Oscar Jimenez, an email, and I'll be happy to send the electronically or by fax the request form for the DVD.
Okay. So why don't we go right into why are we in the boat that we're in? What's caused that, Oscar?
Sure. So and let's start talking about some of the barriers, really, because really here where we start at the beginning, we spent quite a bit of time basically painting that picture of people with psychiatric disabilities are grossly unemployed or underemployed, meaning the majority of us don't work, or if people work, have either minor jobs making very little money or working very few hours. So why is that? And there's this myth out there, and unfortunately we continue to hear it directly or indirectly in society, people that don't necessarily know anything about psychiatric disability, and at times, unfortunately, maybe some support providers that maybe have not been given the information or the training in this area, that the idea that people with psychiatric disabilities just don't want to work, and unfortunately, there are people that have had to ask this question and do research about it, which is maybe counterintuitive, but some people have had to ask this question, and across the board, what any survey shows is that the great majority of people with psychiatric disabilities, when first asked, would you like to go back to work, and often like within the next 6 months is a traditional way to ask it, people say, yes, I do. And here's where we also always want to challenge the other 10 or 30% that say no. We want to really ask you to think about this. Why is it they might actually say, no, I don't want to work? And I don't know, if Matthew, and actually if Matthew or anyone had asked me maybe just at some point in my own path, would you like to go back to work? There was a moment where perhaps I would have said, I don't know. And that I don't know wasn't necessarily because I did not want to do it, but perhaps because I actually felt that I couldn't. And so Matthew wanted to chime in here.
This speaks to the main the questions that everyone's asking about. And for me, I use a more immediate example to address this, and that is about 8 years ago. Our executive director at NIAPRS, Harvey Rosenthal, and I were sitting in front of a playground, and he watching some kids play, and asked me, Matt, you ever want kids? And at the time, I wasn't necessarily in a position to either have children but I had actually lost a complete hope for it. This was one of those abandoned hopes and dreams that we talk about, including employment, that eventually got regained. But as far as being a parent, I had a long list of why that wasn't going to happen, and started to tell him about it. He actually, after listening to it for a few minutes, interrupted me and said, actually, man, I didn't ask you if you thought you could. I just asked you if you want to. And I think that clarification is very important. A lot of times when we are asked if we want to do something, we immediately think about whether we can or can't. And that laundry list of reasons are often built over time and are not easy to address in just one sentence. However, we do want to make sure that people get the chance and the opportunity and the time to think through. Is it that I don't think I can, or is it that I really want to and I don't think I can? That's going to be very important for us to address. And that was important for me in every turning point in my life as a man with a psychiatric disability.
Thank you, Matt. Thank you for sharing that. And so I guess I would encourage everyone, whenever you approach someone and you ask them, would you like to go back to work? And someone says, no, I don't think I can. Ask that question again. You know, I didn't. That was just beautiful. I didn't ask you if you could. I asked you if you wanted, and because that's the hope that is so the hopelessness that can be so pervasive, and that that is unfortunately big reason for the low numbers of people actually working at this moment. And the other question that researchers have asked themselves is, can people with psychiatric disabilities actually work? And unfortunately, there's this myth out there too that somehow, you know, there's this group that is just way too damaged to actually be able to work again. Excuse me. And research around recovery and research around employment shows that the great majority of people, even with the existing employment supports, are able to achieve employment within 6 months to a year. And Matthew shares this information all the time of how research in recovery in general also shows that even people that that group that everyone that many people actually might think that there is a group that is never going to recover also has shown that really we have no say in who recovers and who doesn't. And unfortunately, there's this myth out there that somehow what we need to do in employment services or in counseling is to distinguish, oh, this person will, this person won't. So yeah, we just told you the story of this woman who someone decided a few years ago that she was unemployable, and today she happens to be one of the people that's touching, you know, a lot of people's lives in her region. And not only she's employable, but she's also become a leader and someone who, you know, the state and the region where she works especially would be totally missing of a leader if she had not kept pushing forward and go against that assessment of no, she can't. So hopefully with that we're trying to dispel some of the two myths around people don't want to work or people with psychiatric disabilities just can't work. So if that is actually not the case, if it is not the case that people don't want to work and that can't work, what are the actual reasons? What are the actual barriers that get in the way between people with psychiatric disabilities and employment? And Matt is going to actually chime in here.
Okay, great. So, well, one of the first things is what we just talked about. Tony, you called it self-stigma, and one of the questions that came out. But you know, we really want to focus on this belief that starts to develop inside of us right from the very beginning of some of our situations that we've been through that might have been the start of our experience with disability. But we start to develop messages that say we can't. And those messages build up over time. And sometimes it's somebody actually telling us we can't or that we won't actually work or that we won't be able to. That happens. But ultimately there's this individual level of negative perception about myself or negative thinking and negative self-talk that eventually results in a lack of hope for myself. Then there are those other things around real concerns and fears about losing support and benefits that have been helpful to us in different times in our lives. A lot of times we're given misinformation or we have misinformation about employment and recovery, just like we just talked about and Oscar just clarified. The fact that we may want to advocate for ourselves about something, but we don't have the ability because we don't have the information. And that's why this toolkit for those of us with psychiatric disabilities came out. We wanted a We Can Work campaign that would give us and arm us with the information that we needed to walk into a social services office and say, you know what, there is a Medicaid buy-in, and yeah, I can work, and this is information that you need to know, and here's how I can access that support, and let me show you how to fill out the form, you know, that sort of thing. So whatever it is that we need in order to be able to go back to work, it did start with some very individual issues around whether we had the information, whether we were advocating for ourselves, and ultimately whether we had the resources and the tools. So let's get to some of the systemic issues. There were some long-standing systemic issues that we've been, some of us have gotten back to work despite of, and I think that's one of the issues. There are many of us that have been both advocating for change in these areas, however, also still continue to see problems with, and that's part of why the campaign exists. One of those is that there are still some wrong assumptions by providers about work and whether or not a long-term health condition such as or perceived as psychiatric disability would keep us from being able to work, or would destabilize us, for example, or create too much stress for us. So having really low expectations held by whether it's health professionals or by our own experiences and our own families, that's definitely been an impact on our ability to work or our desire to work. A lot of times you'll also see programming that doesn't involve person-centered planning, and it has a more regimented system where you're going through a step-by-step process, let's say, and work is a year down the line, or work is 6 months down the line, or work is 2 years down the line after stabilization or after a particular period of proving my credibility or ability to sustain a certain amount of treatment. And that approach hasn't been working. It's only been creating more disability and more unemployment. And actually people are having a much harder time getting back to work after spending 6 months or more out of work getting help. So that's really the complicated factor, is that the system hasn't figured out how to be responsive and be more flexible to an individual who says, you know what, I appreciate the fact that the residence wants me to go to a 20-hour program. However, I do have a job waiting for me, and I could work evenings if you'd let me and stay home during the day. However, the system, many programs have had a hard time making adjustments in that area. So that's just a concrete example of area where that could be done differently. And then, of course, treatment teams not being able to coordinate with each other or with supports that are available, and having, so for example, somebody might be working for 6 months towards an employment goal with some members, and then go to another member of their treatment team for a brief visit and be told that they really can't work, and suddenly all that work in that 6 months of building hope has been thrown away because somebody wasn't connected to the overall message of the team, which at the time might have been, yeah, you can work and we'd like to help you. There are many others, and some of the ones that I talked about at the beginning of this webinar have to do with the bureaucratic systemic issues, and that's why we're very pleased to see that the Office of Mental Health, John Allen in particular, pursuing the Medicaid Infrastructure Grant and having the state prioritize that, because if you've ever tried, like some of us, to actually get help to go back to work through government support, you find that there are multiple hoops you have to jump through. So you have you might tell your mental health provider you want to work, but then you got to go through eligibility and admission through another agency, such as VESID, and then you have to go through another agency. So having confusing eligibility and application processes, we really want to streamline that. We got to figure out how to do that. As I mentioned earlier, social service employees had misinformation, were not informed adequately, and were not giving out accurate information about the presence of the Medicaid buy-in for working people with disabilities. So that's just one example of where that didn't happen. And then, of course, even practitioners in systems, in our programs, didn't have the information about work incentives. Even the Medicaid buy-in, after being passed, people still didn't know about that opportunity. Lack of information about rights, negative attitudes about employers, inflexible practices in employment. So sometimes employers have had more rigid practices that didn't allow for flexibility or even openness around potential for reasonable accommodation. And then finally, having a lack of peer support systems that actually supported us to think about how we might be able to keep our jobs and keep ourselves employed. So those are big systemic barriers. There are, on top of that, societal barriers. And some of you already wrote in questions about these. And so, are there negative perceptions about us? Absolutely. Are we perceived as dangerous? Are we still perceived as potentially violent? Are there biases about our capacity intellectually? Absolutely. The fact that there's research that even had to ask the question about whether we can work, has some assumptions about whether that was a question or not. And there was a time where those were questions about women or of those of us who are different, of people of color. So the stigma and discrimination absolutely does exist, and it is a societal issue that we need to take on, and that's why this campaign is so critical. So whether you get the DVD or not, we would love you to become a campaign member to simply take on that one message, that those of us with psychiatric disabilities can work. We are actually willing to, in this very difficult time, step up and join society and really be part of the economic reconstruction of our communities. And so thinking about how we could actually take on that message, not just by being angry about it, but more importantly, helping change it, and really showing what we're capable of doing and contributing where people haven't seen us contribute before. So there are those, especially as we get involved in the criminal justice system. We are seeing now, though, that the criminal justice system is learning and willing to embrace the capacity of people to be able to go back to work. But I think there's probably some more things we have to do there. I mean, I'm talking faster because these are bigger issues. There's so many more to go into, but I want to just both slow down and also emphasize here that whether it's stigma, whether it's discrimination, or whether it's literally just a lack of awareness or ignorance about the rights that those of us with disabilities actually have in regaining employment and regaining our roles in society, we want to be able to challenge them all. And I want to emphasize it is very possible for every one of these barriers to be addressed by an effective campaign, and that's our intent. So am I doing this section as well, right? So in terms of what we can do, so let's talk about some of the things right immediately that we can do ourselves. First of all, regardless of where you are, be part of dispelling the myths, reduce the fear, build the hope. Whether it's your neighbor, whether it's your local town board, whether it's your, as Oscar mentioned, a religious community that you're a part of. There are many times where we start to think, oh, that person can't contribute, or that person may not be able to continue in this community, or that person needs to be separated or segregated for a period of time. Those are the moments where our leadership is essential, where our own experience, our own knowledge, and our own hope needs to be expressed. So please, if I can encourage one thing, is to not let that moment go by, and to really take a moment to express the hope for all of us. The thing I mentioned earlier, which is the opportunity to ask people about their strengths, hopes, and dreams, that's absolutely critical. Whether you're funded to actually support employment or not isn't important anymore. You'll probably be able to, on some level or another in your program, if you're a provider, let's say, find a way to ask people about what they want to achieve and who they are. I know as an employer even, I want to know anybody that works for NIAPRS, I want to know what people's strengths, hopes, dreams, and aspirations are, even if it's not the existing position that they're in, so that we can actually figure out a way to support that. Get to know, if you haven't been there, the local one-stop centers, and get to know your local benefits advisors, because benefits questions are complex. They can be complicated and they're very individual. And when a person has questions, just having the basic across-the-board answers are a good start, but that's the door opener. The more important information comes when you get to sit down with a benefits advisor, with a calculator, and actually play out how is work going to impact my life and my benefits, and how can I move forward in my life as a result. And as I mentioned earlier, continuing to be encouraging in that respect for all treatment providers and families. So, the one question that comes up is, well, I'm not an expert. I can't do this, Matt. You need to give me more information. I said, okay, well, that's fine. I'll give you more information. But we definitely don't need to be an expert to dispel myths and build hope. So recognizing some of these main messages that we've been talking about earlier, which is, look, unemployment is going to be a factor in health decline. It's only going to get worse over time if people stay unemployed. That getting employed actually helps and improves health over time. And people can work and maintain benefits if that's one step in the direction. If there's benefits that people want to maintain, such as health coverage or even some cash benefits just to get started, that's fine. Let's consider it and see what people are willing to do and can do. And then, of course, let's help people understand some really incredible programs in Medicaid, such as 1619B and Medicaid buy-in. So considering that, I'm sure there's a lot of discussion to be had as a result of what we've gone over already, but we do want to give some of that overview information about benefits and work incentives and then return to some questions that have come up probably since then as well. So thanks, Oscar.
Sure, and here's the challenge, right? So we have a role, each of us, in spilling some of these myths, and especially around the benefits piece. And certainly, this is not a webinar only on benefits or even work incentives. So we will not give justice to all the detailed information, and especially we do not want people to make decisions at the personal level based on the information that we're going to share. But basically, what we want is to give you just enough information, the working knowledge that we believe that every advocate, every provider, whether you're an employment provider or not, or a mental health provider in general, or a peer in a leadership position, or a friend, is just enough information so that you are not part of the myths that are out there. One of the main myths that we continue to hear is that if I go back to work, I will lose all my benefits, meaning all my cash benefits. And we're here to tell you that that is not true. The two main examples that we wanted to share with you is two work incentives, two programs that are federal programs that allow people receiving either SSDI or SSI checks to continue to receive their payments for a period of time while going back to work. So the first one of those is actually the trial work period, which basically allows people to actually continue to receive SSD checks for 9 months. At least 9 months, and with a possible 3-month extension. And again, we just want to make sure that people know that this is just some of the very basic information. I know we're kind of running out of time here, so we'll be general, but we really encourage you, if you did not get by email the copy of the We Can Work Campaign booklet, please make sure to contact us, because that booklet has a lot more information that you will need as part of your own education process. But in any case, so the trial work period is a way that people can continue receiving their full SSD check for a period of 9 months, and really make as much as money as they can for those 9 months. There's another benefit for people who are in SSI, and that benefit is the 1619A, and what that basically does is people continue to receive a prorated check based on how much money they're making. In all cases, even though the amount of money that people can receive on their SSI check will decrease, the amount that they're making through their paid work and the amount that they continue to receive always ends up being more than where people started off. And this is where a lot of people actually have the myth that I'm going to make less money if I start working, if I'm an SSI, and their SSI check will actually be less, but the sum between what people receive in their SSI check plus the amount of money that they receive through paid work, it also always ends up being more. The other myth is that we will actually lose our health benefits if we go back to work. And we wanted to also dispel that myth by sharing basically two examples. The one that Matthew actually referred to at the beginning is the Medicaid buying program, and the Medicaid buying program is one of the most underutilized health benefits, or benefits in general, probably in New York State. There are probably tens of thousands of people that are eligible for it, and at this point, less than 6,000 people across the state actually are receiving this benefit. Basically, what the Medicaid buy-in program is anyone who's working either full-time or part-time and has a disability, either certified by the Social Security Administration, or there's another way of getting it getting approved for it through a determination by New York State. But basically, the only requirements are that someone has a disability, that someone is working full-time or part-time, and that their income is less than about $55,000 per year in 2009, and that actually has less than $13,000 in assets. Those are kind of ballpark figures. Most likely that person is eligible for the Medicaid buy-in program, which basically means that the person can keep their full Medicaid under this program as long as they meet those basic conditions. There are multiple resources locally, and we really encourage you to look for either your work incentives, planning assistance, WIPA, WIPA provider, either regionally or locally. Typically, the independent living centers have strong benefit advisors or any other provider to actually get more information about it. And we just also wanted to refer, and please again refer to the booklet that actually has more specific information about it. But there are a series of programs that are also available for people to have access to vocational services, such as the Ticket to Work, and the Plan to Achieve Self-Support, or the PASS. The Ticket to Work basically makes people eligible for employment services, and what literally people receive is sort of like a voucher, a ticket that by which individuals can walk into a provider of vocational services and actually receive support employment, meaning job coaching, job development, and follow-up services for a period of time. And there's also the PASS, the Plan to Achieve Self-Support, basically allows people to put money aside and to make sure that it doesn't count towards income or resources, money that can actually serve to actually go back to school or go back to work, such as computers, transportation, cars, etc. So I know we're kind of like really on our last few minutes here. We wanted to give you some of this basic information. Hopefully, it only encourages you to get more information and just enough to continue passing along also the message that there are work incentives available for people. Encourage people to knock on the door of a strong local benefits advisor group or benefits advisor, and motivate people to sit down, like Matthew said at the beginning, with their particular circumstances and a calculator in hand to see how their benefits, what benefits they may be eligible for, what work incentives, and how their benefits are going to be impacted through going back to work.
Okay, and in the interest of time, I am just going to go over very briefly some of these points around rights and resources that are available. So let me just emphasize there are, a couple things. One is, as a person with a disability, if you're wondering if you have a right to work, you absolutely do. This is something that was confirmed in law with the Americans with Disabilities Act in 1990, that an employer under Title I cannot discriminate against an individual capacity to work based on the fact that they have a disability. So there are, in fact, provisions in that law that require an employer to offer what's considered a reasonable accommodation, as long as it doesn't provide that employer with an undue hardship. And for those of us with psychiatric disabilities, we have been finding that many reasonable accommodations can be offered, and most of them are actually at no cost to the employer. It's usually been more about flexibility in scheduling, to be able to access supports, flexibility in how a particular task might be accomplished or a project might be accomplished, and order to be able to move forward, along with some other types of accommodations as well, which we could probably get into more specifics at a later time. But so you can check out all of that, including the amendments that are referred to here on ada.gov if you can get access to online. The Rehab Act ultimately provides for the capacity to be supported to get back to work. So the belief that rehabilitation for people with disabilities is needed in order to be able to, and that there was a role for the government and for the states to actually support the people with disabilities to actually get back to work. That's something that's emphasized. And so, if there's ever a question around, is it somebody's job to help us get back to work, that's something we want to say, yeah, this is something that's relevant. Even though, and I know that there's been limitations around specific services being able to do as much. Well, let's not look at it that way. Let's figure out what actually we can do. Let's go for what we actually can accomplish within the scope of our services. So, and other resources that we can refer to, which is one thing that you can do, are the one-stop centers that are in your area. Within those one-stop centers, there are a person that's funded called the Disability Program Navigator. That is a person that can guide a person with disability as they come in from a one-stop employment center for support. The one-stops actually have a tremendous amount of support, intensive training, and access to job training that you might want to consider. And then, of course, the New York State Job Exchange, Job Zone. In New York City, there's a workbook that the Coalition of Voluntary Behavioral Health Agencies at the time put together. Job Accommodation Network has opportunities. And then, of course, if you have questions about, as a person with, as a beneficiary of Social Security, if you have any questions, including overpayment issues, the Protection and Advocacy Program for beneficiaries of Social Security, created originally in support of the Ticket to Work, is now available for people with who are benefits of Social Security to address any overpayment issue or any issue that's coming up for them in regards to employment and their benefits. Oscar, do you want to briefly go over what we're saying about peer support now?
Sure, I'll just say two words. The only thing I wanted to mention is that if you're wondering how to contact those resources, the phone numbers or the websites are actually listed also on the We Can Work booklet, so you can actually take a look at that. And also, one other that we did not list there that we also like to make reference at when we talk about the work incentives is that one of the most comprehensive resources for work incentives and benefits is the Red Book by the Social Security Administration, and you can very easily look for it on the internet, Google it, or under the Social Security Administration website, and certainly in your local Social Security offices, they have plenty of copies that actually can be made available. The only thing that really wanted to say about peer support is that hopefully what we've also been able to communicate is that there's something really powerful in our respective stories that is very unique, and that we can support one another just by sharing our stories in ways that nobody else can really. And I know that the inspiration I have received by seeing other people go through what they're going through, like for example Matthew, just not around employment but around his life, and sharing his story of becoming a father, it's an inspiration to me, and makes me think that maybe one day I can do the same. And I know that that's true for so many people around employment, and the stories that we've shared with you today and that you'll see on the DVD are also the part of the uniqueness of peer support, of what we can support, the ways in which we can support one another, that just because of having the lived experience, it's unique to us. So we really want to encourage you to encourage peer support, whether it is a support group, whether it's one-on-one, whether it's actually at a mental health program, or whether it is in the community, whether it's by phone or by email, or encourage people that you know to support one another, to talk to one another. Ask people if you can pass along their phone numbers or their contact information. Tell them, I know someone who went back to work, and ask them if it's okay to actually pass along their information, because there are plenty of people. We've learned in this campaign that there are hundreds, if not thousands, of people out there who are willing to share and volunteer their personal time and say, yeah, I will talk to someone. I will go and show up at a forum and share my story if that's going to help someone.
Tony, you said you had some questions. And then we can go back to
I'm going to just kind of lump several questions together. If the answers are not satisfactory for people, please just write that in the survey at the end, and then we'll get back to you privately, okay? I don't want to leave anybody out. I also want to claim as many as possible. So the general thing is, if I have a mental health disability as well as a learning disability, or my mental health disability is kind of interfering with my cognitive functions, how am I supposed to go back to school to get my GED, or how am I supposed to get a job, or that kind of stuff?
Well, this is a great question. It's one that I personally faced and continue to face, actually. And so the first thing that I need to do for myself, and that I would encourage us to encourage others, or if you're in this boat, to also for yourself, first thing is to reframe exactly how you're looking at yourself. Because one of the things that I would first see about myself were all the things I couldn't do as a result of however I wanted to explain it. So every area that I couldn't do became what was forefront in my mind, and I had stopped thinking about what I could do. So that's really important, because first of all, whether it's looking forward to getting a job or starting to achieve in school, it's really important to become aware of what my strengths are, because that's what we're going to build on. The second component about this is that whether it's in work or in school, there are reasonable accommodations that even educational facilities are required to offer. Part of this is also as a result of the Americans with Disabilities Act. Boston University, if you actually Googled Boston University reasonable accommodations, a site will come up. And they have a specific site that gives guidance for students with psychiatric disabilities and the reasonable accommodations that are available. UPenn also has their collaborative on community integration, very specific information about what you can do in order to be able to go back to school, and what you can do to request reasonable accommodations. Many educational facilities today have an actual office of services for people with disabilities to really make sure that those resources are available. That wasn't available when I was trying to go to school, and I, as a result, was not able to complete the schooling that my family brought me to this country to do. So that's really important to me, that if you're considering going to school, that you do not let that disability or particular inability that you're experiencing right now keep you from pursuing that.
I just wanted to refer in 15 seconds the story of a woman who actually has been a very powerful example for us too, is that was diagnosed with a couple different learning disabilities in her teenage years, and actually was told that she was probably never going to be able to finish school. And somehow, through determination and also some people that were put in her life, she was able to not only finish high school, but it's just graduating right now from getting her bachelor's and in human services. And we just know also that there's some level of of assumptions about learning disabilities that may not be so true. It is possible to complete schooling.
Absolutely. And there are actually now great services, even services called cognitive rehabilitation and remediation, that actually help with specific skill sets that you might need to develop. So it's worth checking those out as well. Tony, was there another question?
I think we can move on.
Okay.
The contact information there.
And we'll end the campaign. Okay, great.
Yes, we're running out of time, unfortunately, and really appreciate so many questions. And we know that there are questions that may have gone unanswered, and Tony will make sure to take note of those, and hopefully at least we can communicate by email. On the screen you actually have Matthew Mathai's contact information and email address, as well as mine. Again, for those of you who may have joined us towards the end, I just want if you would like more information about the campaign, what we're doing specifically, and also this is on the screen right now. You actually have the employment tool for people with disabilities. This is the tool that has more information about work incentives, rights, and some of the self-advocacy information about the way that employment is helpful to mental health recovery. Here, if you didn't receive it, please let us know. Also, on the top of the screen, you actually have the list of the original forums that have been scheduled so far in different towns and different parts of the state. Please take a look at that and see if there's anyone close, and encourage people that you know or providers, families, advocates, anyone who has a role in possibly affecting people with psychiatric disabilities to attend, because they're open to the public, and they have a wonderful program. Those forums, actually, we show the DVD, which is a 25-minute, and present the personal stories of recovery as well as information about work incentives and other rights. So I think that's...
For anyone who didn't get any of the information, I'm going to send out a copy of the PowerPoint, the toolkits, and the We Can Work regional forums that are coming up. I'll send that out to everybody. And I want to thank Matt and Oscar for presenting today. This was really great.
Thank you.
And I really, for anyone whose questions we didn't get to, we will get to them. People who want a certificate, just please stay online until we end the webinar here, and then a survey form will pop up for you. And I'm going to just do one more thing here. Oops, there we go. The May webinar, I just want to announce that the May webinar is going to be on Go Direct and Direct Express, and I think Matt had mentioned the We Can Save campaign, so this is sort of tangentially related to that, around wealth building and asset building for consumers. The Department of Treasury will be presenting this next month, and the webinar information, the registration information is right on here. And again, you'll also get it in the PowerPoint that I sent to you in the next day or two. So thanks again, everyone. I really appreciate it. And take care, and hopefully we'll see you next month.
Bye, everybody.
Thank you. It's funny, it feels like you won the radio or something.